Hi, once again welcome back to Obstetrics and Gynecology videos. Today we are going to see about a totally different topic, that is sexual violence. Any sexual act or attempt to obtain a sexual act, unwanted sexual comments or advances or acts to traffic women's sexuality, threats of harm or physical force by any person, regardless of the relationship with the victim in any setting, including but not limited to home, school, prison, and streets and at work. This is the definition of sexual assault given by the World Health Organization in the year 2003. Why should we take care? If you are looking into the statistics of sexual assault, we will come to know that everybody is supposed to take care of themselves. It is not only for the females, it's applicable for the males also. Merely 1 in 5, that is about 18.3 percentage of the women, and 1 in 71 men, that is 1.4 percentage of the men, reported experiencing rape at some time in their lives. Approximately 1 in 20 women and men, that is 5.6 percentage and 5.3 percentage respectively, experience sexual violence other than rape. 4.8 percentage of the men reported they were made to penetrate someone else at some time in their lives. They were forced to. And 13 percentage of the women and 6 percentage of the men reported they experienced sexual coercion at some time in their lives. So this shows the incidence of sexual violence and sexual assault against males and females. And now let us see the effects of this sexual assault. It leads to unwanted pregnancy. It leads to sexual dysfunction because it may affect the victim psychologically. Later, the victim may get the sexual dysfunction. Chance for unsafe abortion, that is, if they become pregnant, they may try for the abortion, and that may not be a safe way sometimes. Chance for infertility, if they are trying for the unsafe abortion and if a severe infection or some other problems are occurring, there is a chance for infertility. Chance for getting sexually transmitted infections including HIV and AIDS, HIV or AIDS, pelvic pain and urinary tract infection, post-traumatic stress disorder. After the incidents, the person will be having severe stress. Some may get even psychiatric disorders also. Tendency to self-harm, tendency to suicide, flashbacks. They will get the flashbacks frequently. They will be thinking about that. Always that thought will be coming as like a flash into their mind. Some will get eating disorders, some will get depression, and some will get addicted to the drugs or alcohol or to cigarettes. In order to escape from these thoughts, these people may start to depend on the alcohol or drugs or other substances. Now we can see the forms of sexual assault. The first one is rape, that is physical, forced or otherwise coerced penetration, even if slightly into the vulva or anus, using penis or other body parts or an object. This is the definition of rape by the World Health Organization. And next form is sexual harassment. That includes intimidation, bullying, or forcing for sexual nature, or unwelcome or inappropriate promise or rewards in exchange of sexual favors. Next one is groping, touching or fondling of another person in sexual way without that person's consent. That is, just touching itself is coming under the groping. Elderly sexual assault, sexually victimization of elderly individual. That is, if someone is victimizing a person above 60, that is elderly sexual assault. Next is child sexual abuse. It involves an adult or an older adolescent sexually abusing a child. This sexual abusement means it includes asking or pursuing a child to engage in sexual activity, indecent exposure of genitals to a child. That is also coming under the sexual abuse. And another one is domestic violence. Even domestic violence is also may come under the sexual assault. And now we can see who are all the victims: women, children, orphans, men. That means all are the victims of this sexual assault. Next, who are all the perpetrators? It may be a family member, or maybe a neighbor, or maybe a stranger, or maybe a senior. In Nationally Representative Survey in CDC, it is observed that among the female rape victims, the perpetrators were reported to be intimate partners in 51.1% of the cases, and family members in 12.5% of the cases, and acquaintances in 40.8% of the cases, and strangers were there in only 13.8% of the cases. And among the male rape victims, the perpetrators were acquaintances 52.4% and strangers 15.1%. Among the male victims who were made to penetrate someone else, the perpetrators were reported to be the intimate partners, that is, includes 44.8%, acquaintances include 44.7%, and strangers include 8.2%. Now let us see who all are at risk. Young women, the women those who are consuming drug and alcohol, and the women those who being previously been raped or sexually abused, and those who are having many sexual partners, and the people those who are getting involved in sex works, and the people those who are more educated and economically empowered, and people those who are coming from the poor family background. These are at the risk. You may wonder that why economically empowered and more educated females are having chances. They may become overconfident and they may get into they may get trapped into certain situations. Next, we can see the rape management. First, about the diagnosis. For diagnosing the condition, you should take a detailed history from the victim, collect the detailed history from the victim, and record all the events before and after the assault. You have to ask whether the person has taken any drugs. If taken, whether it was voluntarily or involuntarily, whether they have used force, whether they have used any weapons, whether they have used condom, what was the timing and sequence of events, and specific events of the assault and post assault hygiene, and about the last menstrual period, currently whether they are using any hormonal contraceptives, and is there any history of previous intercourse. All these things should be taken. This detailed history has to be collected from the woman. Next, we are supposed to conduct a detailed physical examination, visualize the entire body for the presence of contusions, bites, ligature marks, old and new trauma. And we should see for the distinguishing features like tattoos, piercings, scar, etc. And the areas where we can take the swab, that areas also should be observed. And before performing the speculum examination of the pelvis, the pelvic area, that area also should be observed carefully. And the other areas they may get common injury include head, neck, anus, and rectum. And note for the tenderness, tear, ecchymosis, abrasions, erythema, and edema of these areas. And if there is no findings also, if you are not able to identify any of these findings in the examination also, you cannot tell that it is not a history of sexual assault. You should relate it with the history also. Next, include the investigations. We are supposed to take the specimens. The specimen can be sperm or semen or any other foreign materials, and swabs of body secretions, fingernail scrapings, blood and hair from the head or pubic area also. And along with that, we are supposed to do the HIV test and pregnancy test also later. Next, we can see the management of the people, those who are exposed to the sexual assault or sexual violence. First one, assess and treat seriousness of injuries first. Whether they are having any serious injury, that we have to assess first. Then obtain a consent from the person to do the physical examination, because we are supposed to do the head to foot examination. Take a full history and document all findings. Here the documentation is very important. Conduct full physical examination and document all findings. Document all facts regarding the assault. And in the next step, in the second step, we have to manage the physical effects of the assault, such as wound, bruises, everything. And if such things are there, means give antibiotics in order to prevent the infection. And if they have not taken the tetanus, give a booster dose of tetanus. And if they are having pain, give pain medications and medications for relieving the anxiety also. And in the next step, we should give them emergency contraception if the victim has started menarche and if they came to the hospital within 72 hours after the assault. In that case, we can give Postinor 2, 1 tablet orally, and it should be repeated after 12 hours. Otherwise, you can give Lofeminal 4 tablets and it should be repeated after 12 hours. After the sexual assault, we should consider the chance for getting sexually transmitted diseases. So for all the cases, it is better to give benzathylpenicillin stat. That is, if the weight of the person is less than 25 kg, give 6,000 international units, and if the weight of the person is more than 25 kg, give 12 lakhs international units stat. And start gentamicin 6 mg per kilogram as a single dose, and give erythromycin 12.5 mg per kilogram every 6 hours for 7 days. And we should give metronidazole 5 mg per kilogram every 8 hours for 7 days. This will help for preventing the infection, and to a certain extent it will help for preventing the sexually transmitted diseases also. Next, about the HIV, you should give a test for HIV and you should give the counseling also. And if the hemoglobin baseline reading is available, and if the victim is HIV negative, and if the victim came to the hospital within 72 hours of assault, you should take the HB level and you can start the PEP treatment. And for the PEP treatment, you can give Diovir BD 2 times in a day for 30 days. And if the victim's HB is less than 8 gram per deciliter, Diovir must be replaced with the Lamivir. That also can be given 2 times in a day for 30 days. This will prevent the chance for getting the HIV. All the victims of sexual assault, surely they will be having stress, and some may go to post-traumatic stress disorder. In that case, proper counseling has to be given to the victim and it has to be given to the guardian also. And assess the safety of the victim and refer to other support services such as victim support unit of the police. In case if you are feeling as like the victim is not safe, in that case we should send the victim to refer the victim to other support services. Advice on dates for follow-up the visits, and record findings and treatment in examination record, and provide a copy of the victim for the submission to the police if appropriate. Record all findings and in the treatment book. Thank you for watching this video. See you soon with a new video.